In almost every country, people are being mistreated and misunderstood. We can be excluded by families, friends, neighbors, employers, and schools due to the negative stigma that still haunts mental health.
You cannot. Welcome, everyone. If everyone could take their seats. Very pleased to see a number of new faces and enough room to fit everyone in, which I was just slightly worried about. Okay, now for those particularly who weren't here yesterday, we had a fantastic day. We had Arthur Evans do a really outstanding talk about more than just services, that we need real change across society. We had Matt Haig talk about his own experiences. We had workshops where people put in huge amounts of effort and delivered a set of recommendations which we have taken to ministers this morning and had a really very, very good discussion with responses from, I don't know how many ministers, but there were loads, and we had to run over. We also heard from Alistair Campbell and a panel that did a question time. We got questions from all of you, and to be honest, it was really very, very moving. I mean, it was an hour and a half, but I can promise you, people stood up and spoke very much from the heart. And then finally, we had Francesca Colombo from the OECD and showing their commitment to mental health, and Richard Curtis, who chucked all his notes away and also spoke from the heart about his own family's experience and implored us to not hold back, to push this forward, to take mental health to where it should be in the heart of human life. More than anything, I think yesterday made us listen to the voice of people with lived experience. And I think really did push us for working for equality for mental health. So thank you for everyone for yesterday. Now, this morning there's slight change in the events. We've got Simon Stevens, who's the Chief Executive of NHS England, who's also going to come and do some closing remarks. I doubt it will be long, but I'm sure it will be definitely worth coming for. Now, that just leaves me to introduce the first of our next three speakers. So I'd like to introduce you to Matt Hancock, MP, MP for West Suffolk. He's the Secretary of State for Health and Social Care in England, having been previously Secretary of State for Digital, Culture, Media and Sport. And Matt became Secretary of State for Health in July this year. So I'm very pleased to welcome Matt Hancock.
Thank you very much, Tim, for that fantastic introduction. And I've no doubt that, like yesterday, today we have a great day ahead of us discussing these vital topics. And when I think about the scale of the mental health challenge before us, I take some inspiration from a man who battled with his own mental health for his entire life. And I use the word battle quite deliberately. Because while he was a sufferer, he was never a victim. While he knew what defeat was, he was never prone to defeatism. And he knew that each day required work just to achieve equilibrium, or as he would have put it, to keep the black dog on the leash. And that man was a great Briton from a former age, Winston Churchill. Were he alive today, he would quite possibly have been diagnosed with bipolar disorder. And there's certainly no doctor alive who would have approved of Winston Churchill's self-medication of champagne with lunch, brandy after dinner, port, scotch, and claret at all hours in between. But I have no hesitation, no apology for calling Churchill one of this nation's, indeed one of the world's greatest ever leaders, for whilst he had his many flaws, and which of us doesn't, he was ahead of his time in many ways, partly because he spoke openly about his struggle with depression in the age of the stiff upper lip and buttoned up emotion, when discussion of mental illness was seen as a weakness. He showed humility and compassion and leadership. And thankfully, since then, attitudes have changed. But the question I want to ask today is, have they changed enough? Have we done enough to tackle stigma, prejudice, and discrimination that people with mental health conditions endure? Have we ensured that mental health and physical health are treated equally, not just in terms of resources, important as that is, but in terms of priorities, and our priority as a society? And have we stopped to think about the mental health impact and the mental health needs of the people we rely on the most, our doctors, our nurses, our paramedics, our carers? I think that this summit today and today's declaration and our commitment wholeheartedly to achieving equality between mental and physical health is a bold and ambitious statement of intent. And for us to deliver on that pledge on a global scale, we're going to have to change not just the way the public thinks, but the way that politicians think about mental health. And we are helping to do that by coming together at this summit. I think that this is a defining challenge of our age, and it is a challenge that is sadly growing in scale, especially amongst young people. In the UK, 1 in 10 children now has a mental health problem. Many of them will go on to develop serious mental health problems as adults unless they get the support that they need. And for the sake of future generations, we've got to rise to this challenge, and I believe that together we can. And let's think about the vitality of this agenda this way. The world has changed over a generation, where our lives, and especially the world of work, are defined less and less by our physical capability and more by our mental ability. And in the coming generation, as we live through the march of the machines, our lives will be increasingly defined by our emotional capabilities more than ever, as the machines take on the cognitive tasks. And so as our shift in our lives moves from the physical to the cognitive to the emotional, so it's natural and right that we must shift our healthcare to care equally about the physical and the mental and the emotional. And I say this very clearly. There are some people who still find this agenda uncomfortable. Some still dismiss it as being somehow soft. But I defy you to talk to anyone on the brink, or look at the rising numbers of people in need of help, or live with the consequences of mental illness and not be moved by the scale of the task ahead. So let us today at this summit come together and say, yes, some people find it hard to talk about mental illness, and our task is to make it easier, to break the taboo, to help everyone to get the support that they need, because it is good to talk. Now, change is happening. At the UN General Assembly last month, we saw our first ever standalone event on mental health, hosted by Bahrain and Belgium and Canada, Ecuador and the Netherlands, and I'm very grateful to all those countries for the effort that they put together to making UNGA a success. The UK, together with Australia and Canada, has launched the Alliance of Champions for Mental Health and Wellbeing, and I'm delighted that some others in our ministerial meeting this morning, including France, have agreed to join. This coming together of like-minded people committed to progress on mental health must lead to substantive and sustainable action around the world. The UK has made tackling mental health a priority. We're now spending record amounts of taxpayers' money on mental health services, nearly £12 billion this year in England. And we've set ambitious plans to increase the NHS's mental health workforce by 21,000 and expand mental health provision to 1 million more people by 2021. We're making progress towards no division between mental health and physical health, because that simply doesn't make sense, that division. Not least because both are inextricably linked. People with serious mental health problems and mental illnesses like major depression or schizophrenia have a 40 to 60% greater chance of dying prematurely, often due to physical conditions which go untreated, like cancer and heart disease and diabetes. We simply can't improve physical health without considering mental health too. So I can announce today that we're putting a further £30 million into the global mental health research through the UK's National Institute of Health Research, and Public Health England is launching a new Every Mind Matters campaign, which aims to increase the number of people taking steps to improve and manage their own mental health, as they already do in increasing numbers with their physical health. I've been moved by some of the stories that I've heard at this summit. Particularly from people whose conditions have become worse as a result of poor or inadequate services that they've received. It's been extraordinary how, though the countries represented here at this summit are diverse, their needs different, their starting points quite widespread, the fundamental need and the centrality that people put on the need to support further mental health services to bring them towards parity with physical health services has been paramount. And I think that all of those of us present at the ministerial breakfast would underline that point. We have to ensure that whoever needs mental health support gets the support they need, and that it's the best, most up-to-date support that it possibly can be. And we also need to change our view of people who need mental health services and consider people not just as patients or a medical problem to fix, but to consider people as people. Less about simply the medicinal and the pills, and more about the prevention and looking after people as people. And we must not forget or neglect the care for the carers too. Not just the doctors or nurses or health workers, but those unpaid, often unsung champions who are often doing extraordinary things to support those they love. And we owe it to these extraordinary people to look out for them and look after them too. As this summit has clearly shown, what we learn in one field, in one workplace, in one country can be applied elsewhere. We can and must keep learning from each other. Ultimately, this is about changing the way we think about mental health, and it's about changing attitudes. And returning to Churchill, as he himself said, attitude is a little thing that makes a big difference. I want to work with any nation, with any partner, who has a new idea, an innovative solution, and evidence of how to tackle this global and growing challenge. I want us to keep an open mind, because while we should treat mental health and physical health the same, we know that treatment of mental health isn't the same and is not straightforward. So let us work together on a global scale. Let us act decisively, and let us act now. Thank you very much indeed.
Okay, thank you very much, man. I'd now like to introduce our two partners in this venture. So we've done this with the, it's not just the Department for Health and Social Care in England, but it's the OECD and the World Health Organization. So first off, if we could have a round of applause for Mark Pearson, Deputy Director of Employment, Labour and Social Affairs from the OECD.
Well, good morning, everybody. I've got to start by, first of all, congratulating the UK and thanking Mats and his team in particular for organising this amazing event and helping to put mental health globally on the agenda, driving it up the agenda. We are so thankful that you're doing this. And of course, also thanking you, Svetlana, and Tedros from the WHO, we love working with you. I think when we work together, we can make much more difference in what happens across the countries. So thank you very much to our partners. Those of you here yesterday heard Alistair Campbell advise us that we shouldn't just be talking about the negatives, we should talk about a more positive story around mental health. So let me try and start by doing that, talk about some of the developments internationally. We have seen suicide rates fall in the richer countries of the world, at least, by about 30% since 1990. Even more than that in countries like Finland and Estonia and Hungary. And this hasn't happened by chance. This has happened because the societies involved made a choice and made the changes necessary to reduce suicide rates. We're even seeing mental health spending go up in OECD countries. And Matt, it's great to hear, well, he's just left. I'm looking at an empty chair where he was, but hey. The announcement that the UK is spending more, it's appointing a suicide minister, great news, and it's being echoed across many of the countries around the world. This is very much to be welcomed. But by far the most important achievement, I think, internationally in the past few years, has been that mental health is being talked about and championed by so many people. We were so honoured yesterday to have the Duke and Duchess of Cambridge visiting this event and visiting the workshop on children and young people. Their Heads Together charity tackling stigma and changing the conversation around mental health, certainly in the UK, but also, I think, across borders. I think we have to always mention the former Prime Minister of Norway, Kjell Bondevik, who became the highest-ranking world leader to talk publicly about the experience of poor mental health when he was in office recently. I think that's made talking about mental illness more publicly acceptable in Norway. And look, here at this conference, we've heard some amazingly inspirational people speaking. I mean, those of you who heard the Question Time panel yesterday with Sanchana Krishnan and Michael Jenga, they were amazing, talking about their experiences in India and Kenya. So things are moving in the right direction in some areas. But let's not kid ourselves. They're moving from a pretty awful place. I said already this morning at the ministerial breakfast that, in my view, the mental health system is the worst part of our health systems. I think I can justify that if you want to challenge me on it. We still have enormous challenges in promoting good mental health and providing a better life for those who experience poor mental health. And you know, it's very bizarre that this is the case, because, as you know, about half of all mental health cases are clear by the age of 14, and most are clear by the age of 25. And if we can actually do something early on to help people with poor mental health, the payoff is clear and big. You know, I was lucky enough to be in the children and young people's workshop yesterday, and the best bit for me wasn't actually when they were presenting the experiences of good experiences around the world, though they did that brilliantly, the young people involved. It was when the young people, the leaders in mental health in their age group, sat at the front of the room and talked about their personal experiences. And it was heartrending. I mean, you had to have a heart of stone not to be moved by what they said. Not about the struggles that they had personally, it's about the way they interacted with the system. Because over and over again, they were saying things like not being listened to when they tried to explain their problems, about the delays in being treated, about too many different clinicians being involved, not taking overall responsibility for their problems. You know, we are still treating people as lumps of meat to be poked, prodded, and diagnosed, not personalities with specific feelings and needs. And we all in this room know that this is wrong, and yet we still seem to find it incredibly difficult to change. And we know the results. You know, it's a good theme, and we've probably not talked about it enough at this conference. The theme was actually equality in the 21st century, and we look at the results of our current system. You know, what happens with the people with poor mental health? Their school outcomes are poor. That's not equality. Then they enter the labour force. Labour market outcomes for people with poor mental health, they're 15 to 30 percentage points more likely to be unemployed or without work than people with good mental health. That's not equality. You know, one of the things that most struck me when I first started working on mental health was in the labour market, where we did a big study across lots of countries, about 17 countries, people who were without work, trying to understand what it was that explained why they were without work. So not just people on disability benefits, people on unemployment benefits, early retirement, lone parent benefits. And we found between 40 and 50% of them had mental health problems, overwhelmingly mental health problems that weren't being treated. And this was across 17 different countries. And so for people like me, who are economists, who are supposed to be telling countries about how to get more economic growth and higher standards of living, and we mess around and tie ourselves in knots thinking how we can promote higher productivity in the economy and so on. And here, staring us in the face, is a problem that we don't get to grips with. That if we can just do something about poor mental health, rather than trying to throw money at improving skills of people who are unemployed, we need to do that, of course, or helping them to find jobs, we need to do that as well. But if we can just start treating these undiagnosed mental health problems more effectively, the payoff is enormous, and the result will be much greater equality. I could go on for lots. I must stop because other people must speak this morning. We know lots of great examples about what can improve mental health across our countries. Things that I think I want to point out, I mean, incredible years for promotion of mental health in Portugal, training nursery school teachers and healthcare professionals in mental health prevention. The Canada's Strongest Families Institutes, Families and Youth Program, low-cost mental health training to overcome barriers in accessing services. The Good Behaviour Game, which is used in lots of your countries. There are many interventions that we know are cost-effective and often even cost-saving, and we can strengthen the mental health and well-being of mothers and infants as well as school-aged children. I need to finish. I think it's clear from what I've been saying that I do believe much more can and should be done to address mental health problems. It is obviously a human rights issue. It's also an economic issue. We have a very strong case for doing something. I'm really looking forward to working together with all of you and with our partners in order to improve mental health in the coming years. Thank you very much.
Okay, and finally, for our opening speeches, we've got the World Health Organization, Svetlana Axelrod, who's Assistant Director General, responsible for non-communicable diseases and mental health. So, Svetlana, thank you.
Thank you very much, and I'm very honored to be here on behalf of the World Health Organization, and Dr. Tedros sends your welcomes, and it's a great pleasure for me to be here. And I want to take this opportunity and first of all to thank UK for the championship on the mental health. So, excellencies, colleagues in mental health, ladies and gentlemen, Dr. Tedros has apologized that he is not in person today with us, but he wishes a successful summit. And WHO's constitution, which was adopted in 1946, explicitly identifies mental health as an integral part of health in this first principle. Health is the state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. Despite this clear declaration, mental health has for too long stay in the shadow of public health and has been ignored, overlooked, and often entirely forgotten. It has certainly not been put at the same level as the physical health. But let just me remind you a latest statistic. Depression, which affects more than 300 million people worldwide, is a leading cause of disability. And nearly 800,000 people die from suicide every year. Because little or no value has been placed on mental health in many countries, people with mental health conditions receive no services. Or they receive some service, but there is inadequate. People with several mental health conditions are often confined to large, poorly equipped mental hospitals where their rights are violated. They are treated and its existence is not adequate. They may be physically isolated and secluded. Where these people, they may feel stigmatized, where they may be held for a lifetime. In the past time, for practices like these to stop. And ladies and gentlemen, as I have already mentioned, more than 300 million people in the world are living with the depression, and more than 260 million people are living with anxiety. Both of these disorders can be effectively treated, yet so many do not have access to treatment. But changing this situation means putting money into mental health services. In many low and middle income countries, less than 1% on the health budget is spent on mental health. And I ask you, is 1% is likely to provide the services? I am sure you will agree that it is not. The percentage of health budget designated for the mental health must dramatically increase. But at the same time, we have a good news, and mental health and well-being are included in the Sustainable Development Goals. This shows that the world has recognized the importance of this topic not only for the health but also for the development. Mental health is also high on the agenda of the WHO. Its importance is being stressed in several ways. One of the triple billion goals in 1 billion more people with universal health coverage. We are working to ensure that mental health is included in universal health coverage essential services. To implement WHO 13 General Program of Work, mental health will be one of the organization's flagship projects. The aim is to dramatically step up the piece of work in the area so that many more people will receive mental health services in the next 5 years. Mental health is finally being recognized as the part of the non-communicable disease agenda. We used to speak on our 4 main non-communicable diseases, and there are 4 main risk factors. So it is cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases. And the risk factors is tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol. It was 4x4 agenda. But now we have added mental health as the 5th group of conditions. And this is a powerful statement to countries that mental health conditions are just as important part of the non-communicable diseases. Ladies and gentlemen, although these are signs of progress, we have a very long way to go. But momentum is continuing to build with the kind of interest in and support for the mental health agenda we are now seeing, and I am confident that there is no turning back away. So there is no health without mental health. Thank you for your attention.
Thank you, Svetlana. Now, if everyone can just stay where they are, before we have the Lancet Commission coming up on stage, I'd just like to show you a a film produced by Time to Change, which is being launched online as we speak by Matt Hancock, Secretary of State. So if we could now show...
My name is Victor Ogo. I've been diagnosed with moderate to severe depression.
My name is Wairimu Gitonga. I'm Kenyan.
My name's Nadia Hussein and I suffer with panic disorder.
Andrew.
My name's Matthew Williams and I've struggled with depression.
My name is Samuel Masharia Joroge.
My name is Sanjana Krishnan and I live with bipolar disorder and borderline personality.
I'm Glenn Close, and I'm supporting Time to Change. Mental health issues affect millions of us across the world. Sadly, in almost every country, people are being mistreated and misunderstood. We can be excluded by families, friends, neighbors, employers, and schools due to the negative stigma that still haunts mental health.
You cannot get a job, even within family level. There are decisions that are never taken seriously because they're associated with a malfunction kind of a thinking. So one is excluded from the mainstream family life and the society in general.
I was at my worst when I had nobody to talk to. Or I was told that it was all in my head, or that it's just who I am, or it's my hormones. Every time that line of communication got closed, it just made things worse.
My mother has simply ignored it completely. We don't talk about it.
I suffered bipolar when I was in the university. At the time, given a criminal type of punishment, because they thought that I was a criminal and I was not sick.
There is that thing as a man, that pervasive, I guess, sense that links it with weakness, and you should be able to cope.
Almost 1 in 4 of us will experience a mental health problem. Mental health problems know no boundaries. It affects all ages, all income groups, and all cultures. If you don't struggle yourself, then someone you care about probably does.
My whole life, I felt like it was just me. I was the only person who was suffering. And then I realized there are hundreds and thousands of people who suffer the same thing. That for me was the biggest therapy, was to actually realize that I'm not on my own.
Stigma and discrimination are so deeply ingrained, they damage the priority placed on mental health. Around the world, mental health is seen as the poor relation to physical health.
You know, there's all these associated things around mental health where it's just not on a same footing with physical health, and I think it all plays into this idea that it's somehow your fault.
What this results in is lack of treatment for mental illness, lack of awareness about mental illness, lack of acceptance that someone is going through a mental illness.
The good news is we can transform societies by shifting stigma and tackling discrimination. The most effective approach is when those of us with experience of mental health problems start talking more openly.
So I can say that change began with my family members first.
We are going to change the culture, and we are seeing a change in the climate, because the discussion is improving, discussions are increasing, especially among young people.
Now I see with all the stories of Time to Change that those stories are how we change hearts and minds.
In India, we're only going to begin combating the stigma against mental health if we start having an honest conversation about it.
Let's start a new global conversation about mental health that takes root in all of our communities, so that wherever you live in the world, there isn't any shame attached to mental health. If we achieve this and put mental health on an equal footing to physical health, and why wouldn't you? Our world would be a much better, fairer, healthier, productive, and happier place. It's time to talk about mental health.
Okay, and actually some of the people on the video are here and are willing to give autographs later. Okay, I'm now really pleased to introduce the launch of the Lancet Commission. We've got Richard Horton, who's the editor-in-chief of The Lancet and probably needs no other introduction than that. Vikram Patel, who's going to kick us off with a brief talk. He's the Pershing Square Professor of Global Health and the Wellcome Trust Principal Research Fellow at the Harvard Medical School. He was also one of the experts in the expert advisory group and helped us pull together this summit. Now, we've also got Lancet Commissioners Jeanette Petitpas-Taylor, who's Minister of Health in Canada. We've got Helen Herman, who's President of the World Psychiatric Association up until 2020. We've got Charlene Sunkel, who some of you will have heard before during this summit, and Grace Gatera. Now, I think that's the full set. So I'm going to invite them to come up on stage. And from now and the next 50 minutes, you're in the hands of Richard Horton. Thank you.
Come on, panel, up you come. I'm going to sit there. Vikram, you're there, in pole position. So good morning, everybody. My name is Richard Horton from The Lancet. It's great to see you all here. And I'm glad you all stayed after the headline speakers have finished. I'd like to also thank the United Kingdom government, World Health Organization, and OECD for their leadership in bringing us all here today. 10 years ago, few people were talking about mental health. Today, it feels like everyone's talking about mental health. So let's hope that it won't take another decade before we actually start doing something about mental health. Because hope is not a strategy. The goal of the commission you're going to hear about now was to accelerate action, to create a demand for action, to provide the tools for action, and to offer a means to measure the impact of that action. In 2007, 11 out of the 28 authors of this commission came together with others to establish the Lancet Global Mental Health Group. And in a series of 6 papers, they set out why, as you've heard this morning, there can be no health without mental health. They argued that resources for mental health were scarce, inequitably distributed, and inefficient. They summarized the evidence on prevention and treatment for mental health conditions. They documented the poverty of mental health systems around the world. They analyzed the barriers that were obstructing improvements to mental health services, and they issued a call to action to scale up mental health services. That series led to the creation of the Movement for Global Mental Health, and 10 years of persistent advocacy and campaigning with many other organizations has made mental health a core priority for the international health community. But we have to admit that our job is not yet done. In fact, we've only just started. That 2007 series was written during the era of the Millennium Development Goals, when non-communicable diseases were not even recognized as a global objective. And thankfully, with the Sustainable Development Goals, non-communicable diseases and mental health are now central concerns. But although we might have no need anymore to answer the question, why mental health, we definitely still have to ask the questions forcefully, what and how. This commission has taken 2 years to research and write, and we are extremely grateful to our commissioners, many of whom are here in the room, especially to Vikram Patel and Shekhar Saxena, who are our joint co-leaders of this commission. We want to thank the US National Institute for Mental Health, Grand Challenges Canada, MQ, and the Wellcome Trust for supporting that work. And I want to thank and acknowledge the work of my two colleagues, Helen Frankish and Niall Boyce, from the Lancet in leading this commission from our side. The commission provides a radical reappraisal of mental health. It redefines the place of mental health in our societies, in all societies, across all ages, and as a fundamental human right. This commission talks about justice for those living with mental health. Justice is more than equality. Justice means inclusion, embracing those living with mental health as part of the family of human beings around the world. Justice means empowerment, giving those living with mental health the tools, the opportunities to create demand for themselves. I'd like to, if I had a marker pen now, I'd cross out equality and put justice for mental health in the 21st century. The movement for global mental health is now entering a new era. The international community has created an historic opportunity to situate mental health as an essential dimension of primary health care 40 years after Alma Ata, universal health coverage as a core development priority up to 2030, and as a critically necessary element of a nation's idea of sustainable development. But this commission also looks forward. It looks forward to a time when discrimination against those with mental health conditions will be at an end, when political leaders recognize and act and don't ignore and don't dissemble on the mental health needs of their peoples, and when communities are empowered to demand the attention and services that they need. It's a great privilege for me now to invite Professor Vikram Patel to tell you more about this commission. Vikram is Professor of Global Health at Harvard Medical School and a tremendous global leader of this movement. Please give a warm welcome to Vikram Patel.
Thank you, Richard. Thank you very much. I should remind you, Richard, it's not 2 years, but 3 years. It feels a lot longer for those of us who've been putting this together. Obviously, for the editors of The Lancet, it seems only like 2 years. But I want to start by, first of all, thanking Richard Horton. Because the truth be said, about 10 years ago, when we did the first Lancet series, of course, that was also 3 years of work. So in fact, it's almost 15 years ago now. I remember writing a letter to Richard, egged on by my colleague Martin Prince and Shekhar Saxena. We've been in this effort for at least as long as that, if not longer. And I remember all of us holding our breath and thinking, oh my God, will The Lancet, the world's leading global health journal, really have any interest in a subject like mental health? And Richard, the truth be said, as you know, within about an hour of us sending off an email to him, he said, let's talk. And this is where we reached today. And I think I want to thank you, and I want to thank The Lancet for always giving space to this very long neglected issue in global health. Let's be honest, friends. Most of us really, when we think of the word mental health, and I include everyone here, let's just examine. When you hear the word mental health, the truth is that most of us automatically think of mental illness. But of course, mental health, as we've heard repeatedly, is much, much more than mental illness. In fact, I would argue that mental health is the foundation, the very foundation of the capabilities and skills that each of us needs and uses in our everyday life to make our lives worthwhile and meaningful, not only for ourselves, but for the people around us and our communities. Indeed, mental health is much more than even the absence of mental illness. It is, in my view, the most valued, the most treasured aspect of our personal lives, our personhood, and indeed, our humanity. This is why, when the global burden of disease, which is, I think all of you will be familiar, a major exercise to try and estimate the overall burden of each health condition in the world, this is why, when the global burden of disease asks people to value health states, and I'm not sure how many of you know this fact, that most people in the world will rank mental health conditions as the conditions they fear the most, the ones they value the least. Incredibly, people actually would rather have paraplegia than have schizophrenia. Think about that for a moment. And I think you begin to realize why each and every one of us, in fact, values our mental health so much, and yet we rarely speak about it. You think with this enormous value that we put to our own mental health, that mental health would be at the top of every agenda, not just the health agenda, but indeed the development agenda. And today we can celebrate the fact that there is a recognition of the importance of mental health as a core development agenda, as we've heard by the recognition of mental health as one of the fundamental health targets in the Sustainable Development Goals. However, we've also heard repeatedly that the situation is still very bleak across the world. The Lancet Commission begins by examining the reality of the mental health challenge around the world. And that reality starts by recognizing that the burden of mental health problems is inexorably rising in all countries as a proportionate burden of the overall burden of disease. And of course, a lot of that is being driven by the dramatic demographic transitions across the world. In many developing countries, the movement of childhood into young adulthood, and in many developed countries, the movement into older age. Both of these being developmentally critical periods for the emergence of different kinds of mental health conditions. We know that mental health problems don't only disable, yes, but they also kill. We don't recognize that often enough. In the two countries that I spend and split my lives in the US and India, in fact, it is mental health problems that are the leading cause of death of young people. Opiate dependence in the US and suicide in India. In fact, if you look globally, a young person is more likely to die today due to a mental health problem, and by that I include substance use conditions, than any other single cause of death. We haven't acknowledged enough how deadly mental health conditions are at the prime of our lives. And mental health conditions are also profoundly interrelated with social determinants. We've heard that repeatedly. Deprivation is very strongly associated with poor mental health in a variety of different ways. And as certain kinds of disadvantages increase, for example, conflict and displacement in many parts of the world, we can expect a continuing increase in mental health problems in those who have been affected. And yet, and again we've heard this repeatedly, no country invests as much in their mental health care budgets as is reflective of the proportion of the burden of disease in that country that is accounted for by mental health problems. And in this respect, every country in the world can be considered to be a developing country when it comes to mental health. Indeed, for me, mental health is truly the global health issue in which all countries are united in terms of the neglect to this core fundamental area of health. And the consequence, of course, is that there's a colossal human suffering and enormous impact, not just on personal lives, but on national economic well-being. But perhaps most egregious of all is the human rights abuses faced by people with psychosocial disabilities. These human rights abuses are almost primal in their nature. The fact that even today, as I speak, countless thousands of people with serious mental illness are chained to walls, to trees, or indeed in so-called mental hospitals, and that countless thousands are incarcerated in prison, is a reflection of the fundamental failure of humanity when it comes to the care of people with psychosocial disabilities. And finally, let's not forget about the developing brain. Appalling deprivations from undernutrition to neglect continue to blight the lives of hundreds of millions of children around the world, blighting the prospects of their mental health in later life and increasing the odds that they develop mental health problems. Now, over the past 3 years, 28 individuals drawn from diverse countries, geographies, constituencies, and stakeholder communities have worked tirelessly together to examine this challenge and to try and understand what might be a way for the future to address this challenge. And at this point, I'd like to add, I request all my fellow commissioners who are present here today, and I know many of them are, I'd like you to stand up to be counted and to be acknowledged for the hard work we've done together. Please, could you all stand up? Today we publish our findings in the Lancet, and each of you has a copy. And I'm only going to really simply say that we think we have reframed or tried to reframe. In some cases, the reframing is something that many of you, this is a bit of an echo chamber as well. Nevertheless, many of you will find it very familiar, but hopefully some of these will be quite challenging and provocative. We do believe that we need a fresh way of thinking about mental health that incorporates oftentimes the very different conversations and ideas that different constituencies have. And we hope that we've struck the right balance. We know it's not perfect, and not everyone will agree with it, but I hope that we've certainly pushed forward the opportunity of consensus and agreement, at least by an inch. And what are the three key reframing principles? The first is that we have to move away from a binary way of thinking about mental health. It is not the case that mental health is as simple as mental illness. I cannot divide this room into people with and without a mental health problem, because mental health lies on a continuum. We're not talking about an infectious disease. We're talking about something that is so complex, so central to our very nature. We need to recognize that it is a dimension that extends from well-being and wellness at one end to enduring disability at the other. And each and every one of us right now at this moment is somewhere on that dimension. We're not talking about the other. We're talking about ourselves at every moment of our lives, awake and asleep. And across this full spectrum, there are things we can do. When we are well, there are things we can do to stay well. When we are distressed, there are things we can do to move to the wellness stage. When we are sick, there are things we can do to remit our sickness. And when we are disabled, there are things that we and others around us must do to ensure that we're included in everyday life and that we have a quality of life in spite of our disability. Second, we must abandon this age-old controversy. Is mental health and mental illness due to nature or nurture? Of course, it's both. Of course, the science tells us that it is the intimate interaction of psychosocial and environmental factors with our biology, with our genes, but most importantly, across a neurodevelopmental pathway, particularly during the first 2 decades of our life. And because environments in these first 2 decades of our life are so central to shaping our mental health, our brain health, our well-being, right across our life, it therefore behoves us that we must invest in nurturing environments, particularly in these 2 decades, at home, at schools, in our communities. And this is the route for the prevention of mental health problems. And the third reframing, and of course, this is something that will be familiar to all of you, is that we must adopt a rights-based perspective. And by rights, I mean a number of different kinds of rights. The first is the right for each and every one of us to be protected from the harms to our brain health, to our mental health. And when we're exposed to such harms, for example, those of us who might have suffered the indignities of being displaced by war, we have the right to environments that will help us mitigate those risks. When we're unwell, we have the right to care. But most importantly, we have the right to the choice of the care that we want. We do not need someone else to tell us which care we should be receiving. And when we are disabled by our condition, we have the right to agency. We have the right to participation. And most importantly, we have the right to freedom. Now, achieving these aspirations, we've heard a number of different ideas, and in fact, I'm just going to end by telling you about 6 very specific actions that the Commission recommends. These actions are really born out of some of the wonderful work that is being done around the world in rich and less developed countries that have demonstrated how we can actually address this challenge. And I have to tell you all, friends, I'm sure many of you were present yesterday morning when Arthur Evans spoke. I thought it was one of the most remarkable examples of collective action to promote mental health and move beyond a narrow clinical focus of mental disorder. So I'm just going to summarize what those actions are. The first is that mental health services must be fully integrated within universal health coverage. Let's be honest, the word universal doesn't only mean reaching all people. It also means reaching all the needs of all people. Universal health coverage cannot be universal without mental health. Second, that we must recognize and address the barriers and threats to mental health. And by this, I particularly refer to discrimination, but I also mean some of the social factors that are driving the tide of poor mental health, particularly for young people. Thirdly, that mental health must be protected, and this protection must mean the championing of mental health through public policies by the country's leadership. And we're already seeing this with UNGA, with the non-communicable disease agenda, and I'm thrilled that, in fact, the NCD agenda has now been expanded to include mental health. But in doing so, we must always remember the need for working with other key partners, and in particular, people with a lived experience and young people. Fourth, opportunities and innovations for action must be addressed. It must be embraced and scaled up. And one of the key opportunities and innovations that the Commission report champions is the tremendous excitement around the fact that mental health interventions from prevention through to recovery can be delivered by a whole range of providers in the community. This is not only the domain of health professionals or mental health professionals, but indeed the business of everyone. And we've heard such wonderful examples of that over the last day. The delivery of psychosocial interventions by frontline workers and the use of technologies, particularly digital technologies, to accelerate the delivery of these interventions is something that the Commission is extremely excited about and even bullish, and suggests needs to be scaled up. Fifth, of course, we've heard a lot about new money. I won't say any more about that, but I think we also have an opportunity to repurpose existing funds. For example, the money that's being used for maternal and child health, some of it could be repurposed for integrating mental health. The money that's being used in the mental health care budgets, no matter how meager, could be repurposed from mental hospitals to community-based services. That is an opportunity we have here and now while we're waiting for new money to be made available. But I'd also like to add, for all of us who work in the rich north, let's not forget development assistance. For the poorest countries and the poorest people in the poorest countries, rich countries have systematically failed providing development assistance for mental health. And we have a lot of work to do in the rich north to correct that inequity. And finally, let's also not forget the need for continuing investment in the science. And by science, I refer not only to delivery science, of course, that's so terribly important. We need to address not just the fact that the vast majority of people don't receive access to care, but that the care is of poor quality. So delivery science remains an extremely important part of the agenda, but we also need to acknowledge there is a lot more we need to learn. And therefore, discovery science that allows us to further understand the causes and the mechanisms through which mental health can be promoted and mental illnesses prevented, and new interventions discovered, is still an extremely important piece in the agenda. I will return a little bit later on to summarize some of the forward-looking messages and, most importantly, the dissemination that we are hoping to do with all of you and others of the Commission. But at this stage, I'm going to hand back to Richard and the panel. Thank you very much.
Well done, Vikram. So now we're just going to stay seated. And it's an opportunity to hear from our fantastic panel. I'm going to ask each of our panelists a question. If we have a little bit of time, then we'll have some discussion at the end. And we're going to start off with Helen here, Helen Herman, who's on my immediate left, who is president of the World Psychiatric Association. Welcome, Helen. Vikram, of course, rightly said that these issues that we're talking about today are the business of everybody, but you very much represent mental health professionals. So I wonder if you'd like to talk a little bit about what's the contribution that you see, based on this commission, for reframing the role of mental health professionals in addressing mental health.
Well, thank you very much, Richard. I'm grateful to you and Vikram and Shekhar, Martin, and all the commissioners, and all in this room for this opportunity, and particularly for the opportunity to be engaged myself, and so bringing in the World Psychiatric Association to this, the Commission, and in a way representing mental health specialties of other types as well. Mental health and psychiatrists also have been alienated from healthcare for centuries, and this is the opportunity. Mental health professionals, I know, have often feel at a loss themselves how to manage when they're separated, how to manage when families and people living in different conditions come to them and seek solutions. So the opportunity to think through together how we make mental and physical health care as closely and intricately connected as the conditions are, this is our challenge. and being part of primary health care, part of universal health coverage. This is fundamental. But how do we bring that to pass? Well, a mixture of educating professionals and giving them the opportunity, having other cadres of workers, working with communities, empowering communities. And I think of the example of perinatal mental health care, a neglected problem, and with important public health implications throughout the world for the women themselves, their families, and their growing children. The answer to that is not only with psychiatrists, but it includes them. It includes them in working with other health workers. It includes them in supporting the empowerment of women's groups and communities. And this type of approach is important in chronic conditions. It's also important in early intervention. It's not until we become part of general health care that people, particularly young people at the early stages of their conditions, will come forward. And we need to find innovative ways, and the young people here will lead us. This is the fundamental, as we've said. And a community-based care is fundamental. So much of our resource and so many of our professionals are tied up in working under poor conditions in large institutions, or working in prisons, and seeing people that they, with long-standing conditions, whose recovery is certainly not possible under those conditions, but instead working with dedicated groups and families in communities. And a third important aspect of the professionals' work has been to support the prevention and of mental ill health and the promotion of mental health, as you and Vikram and others on this morning have already been mentioning, that we professionals are very much behind this. We see this as a critical part of the solution, not only those of us that have a public health background, but those especially. So I'll just mention that the World Psychiatric Association's Aspiration is a world in which people live under conditions that promote mental health, and in which people have access to treatment and care that meet appropriate professional and ethical standards that integrate public health principles and respect human rights. And I think that's where we as professionals, we see ourselves as supporting development, as supporting the Sustainable Development Goals, global mental health, and being able to support the integration of healthcare and the support for people living under adverse and difficult conditions, including women and men, and the young women and men whose strengths and needs we would like to work with. We're necessary, but we're certainly not sufficient. And it's this new spirit of partnership that we bring from the WPA.
Very good. Thank you, Helen. Give her a round of applause for that. Fantastic. Charlene, we talked about the movement for global mental health, and you're the leader of that movement, so you're very welcome this morning. I wondered if you could tell us a little bit about what you think this commission offers for people who are living with mental health conditions presently.
I think as a person with lived experience myself, having been part of the commission was an excellent experience for me. Not just only in learning, but having an equal platform with the other professionals and researchers who was part of the commission. I was thinking, if I think of the commission, what does it mean to me? And the first word that actually comes out is hope. Mm-hmm. For me, it creates absolute hope. If I have to reflect back on when I was diagnosed with schizophrenia in 1991, how my life was then and the changes that happened over the years, I distinctly remember back then with my diagnosis, I was told, you can no longer work, you can no longer live alone, you can't manage your own finances, you can't drive a car, and worst of all, I can't make my own decisions. So you can imagine what impact that has on a person, where your independence and your dignity are just kind of ripped away from you. And I think this commission kind of shows the complete change. I would like to believe that me sitting here right now is proof to the opposite of what I was told, how useless and, you know, no dignity for me. And I think the commission emphasizes this, that first of all, what I think is important is the recovery approach. Because recovery is, the essence of recovery is hope. So where people actually decide what they need to achieve recovery, and not what others decide they need. And then, of course, with the professionals and the services available as a support to what services and what they need to recover. I think a very important point and outcome as well is the human rights-based approach, where human rights are underpinned and must be underpinned by all services provided. And where your diagnosis, if your diagnosis with a mental illness, should not determine whether you have or are entitled to human rights or not. And that doesn't only apply to your rights in the health or mental health sector, in all sectors. Your right to employment, education, housing, all the rest. Mental health is a cross-cutting issue, and we need to address it that way. And I think it's also been acknowledged and emphasized in the Commission. And also, I think throughout even the summit, I heard very strongly how important it is for people with mental health conditions to be at the center of the mental health response. And also where their stories are so essential in breaking down stigma and tackling discrimination as well. I think lastly, I would really like to see how this commission will mobilize people with lived experience to actually go out and ensure and advocate, use this as an advocacy tool to advocate for quality services which are also accessible with a recovery approach and which is focused on human rights. Thanks.
Thanks very much, Charlie. Fantastic. Grace, it's your turn. Thank you ever so much for being here. One of the lessons we had from our Adolescent Health Commission a few years ago is that you can't do any piece of work without including young people's perspective. And Grace, it's really great you're here. You're part of the young leaders for the Lancet Commission. And I wanted to ask you, what does all this mean for young people?
That's a good question. Thank you very much. First of all, I have to stake my claim as a young person. I'm 25 years old. That's very important. And well, the commission is, from what I've seen, young people are central in the commission because, I mean, we've been talking from when we were young, we're like, the future is tomorrow. Young people are the future. But I think young people are now, and we need to talk about mental health right now for young people. And yeah, so as a person with lived experience, I think it's important to discuss how the Commission is talking about normalizing mental health challenges and talking about mental health to make it sort of mainstream, to eliminate the stigma for young people. As well, I was diagnosed with a lot of things as a Rwandan because of the genocide against the Tutsi. I had PTSD. I was diagnosed with PTSD, and that comes with an array of things because once it goes undiagnosed for a long time, then you sort of pick up little disorders from on the way to growing up. So I grew up with panic disorder. I grew up with severe depression, and I am a 2-time suicide survivor, which means that I call them darknesses. I was just trying to eliminate the darkness that I felt in my body all the time. I felt so empty all the time. And this comes from the fact that for a long time we didn't go home. I've just actually moved to Rwanda last year, which is sort of like a coming home, feeling. But before, it's like you're going through all of these things and you don't even have a home to ground you. So you're being stigmatized for feeling all of these things, having panic disorders at school, you know, having attacks and anxiety attacks, and the teachers who are supposed to help you and, you know, take care of you. I used to live in Uganda, and I think if there are any Ugandans here, they know that part of growing up is being beaten a lot, being caned for every small thing. So having anxiety disorders, I was caned for that, and then I would like get hospitalized for being caned a lot, and then that would also lead me to just deteriorate. Honestly speaking, I was horrible. You know, it was horrible. It was a horrible experience, and I don't even have, you know, you know, like the fact that I have a country of my own. You know, like, to ground me, to say at least I am in my country and at least these are my people. Being in a strange country sort of makes you groundless and makes you feel really lost. Anyway, so going back to the commission, it is important that the commission is talking about normalizing mental health disorders, normalizing mental health challenges, making it mainstream, making it okay. Eliminating the stigma around mental health, eliminating all the talks, you know, making sure that young people are heard and that their voice is heard all the way. And it's important that we have more care, especially for young people. And that's one of the things that the commission is talking about. And, you know, I applaud my country for having, they have programs where they have community health workers that, you know, they're in society, they go to villages and, you know, they take care of mental health people in, you know, people with mental health challenges in villages, but we need a bit more of that. We need to be upscaled. We need people to be trained to go out and, you know, identify this in schools, because young people are actually suffering in schools. Children as young as 8, children as young as 7, children as young as 2, you know? They are facing this, and it's time we talk about it. And we also need to make mental health services better, clearer, you know, and more focused on the prevention instead of, you know, being sick and then going for the medicine. Also, I have to, you know, bring it back to, in Africa, we need better medicine for mental health care. A lot of the medicine that is available right now has severe side effects. And, you know, I'm sorry to say this, but some of it is racist. A lot of this is a bit racist because we are not seen as people who have equal or more mental health challenges than, like he said, the rich north. So while we need comprehensive, you know, preventive mental health, you know, treatment, we need even better medicine right now. Send better medicine. Send the medicine you take here to us. Sorry, I'm becoming a bit of an activist. And also, we need more young people. This is what the commission talks about. We need more young people in roles of leadership in designing mental health services. I'm going to talk about a village in Musanze where I'm part of a group that goes around collecting stories. Please tell me when I'm late. Yeah, there's a village in Musanze in Rwanda that has community health workers. But what's special about this village is that all the community health workers that are taking care of people with mental health challenges are all former mental health, you know, survivors. So they take care of their fellow. They know. And every week they hold a lunch for the whole village. So they cook food using their own money. They make rice. They make, you know, beans. And then they talk about their experiences. And a lot of these are, you know, schizophrenic. They're former schizophrenic, the people who had depression. And my favorite is a man called Bakira Nzovu, who was locked up for 9 years. And he was locked up for 9 years because they assumed that he was a criminal because he was schizophrenic. But now he's an upstanding member of community and he's a health leader. And he talks about his experience and cries, which is important for men, especially middle-aged men, to show that they have emotions. So he talks about it, and this has transformed the way mental health is viewed in that part of Rwanda. And imagine if that was large scale. Imagine if we had that conversation from young leaders from people who say, listen, this is, part of us. This is normal. You guys, this is, what I'm saying.
So Grace,
yes?
I want to ask you a question. I want to ask the whole panel a question as well. This is great that we're here today. It's great to have ministers standing up and talking about statements of intent. Thought we got past that, but anyway, statements of intent. We've got this commission. But what do you want to happen next? I don't want this commission to sit on the shelf or on a website and we move on to whatever the next issue might be. I want us to use this, to do something with it. What would you like to see use it? Answer that if you could, and then I'm going to ask Charlene and Helen and Vikram the same question.
I would like to see action now.
Yeah.
And I'd like to see young people at the head of that action. Yeah, that's why we have the young leaders for global mental health who are working on this campaign with the Lancet Commission, as well as the UK Department of Health and Social Care. We are designing, campaigns to make sure that the message of the Commission is disseminated to everywhere. And we're fantastic. We are 15 people from across the world, and there's so much diversity. Yeah, so I'd love action now, tomorrow. Let's go home and, start acting. Yeah.
Fantastic. I'll give you a round of applause for your comments. Thank you very much. So, Charlene, what next?
I kind of agree with the action now. I think if I may call it this, to see this Lancet Commission report as a Bible that we can use, and an excellent advocacy toolkit. If you want to go and advocate for improved services, quality services, human rights focused services, take this, use this, keep referring to this. And I think it's very important that we all take the key messages from this commission and start disseminating it. Get the conversation going. Plant these facts and realities in people's minds. And I think it's got the potential of really getting us to where we want to go.
Thanks very much, Charlene. Helen?
Well, I'd like to change professional education and continuing medical education tomorrow or today. One of the largest countries in the world still doesn't examine its medical students on psychiatry. So
Which one is that?
India.
Really? Okay.
So my Indian colleagues may correct me or expand on that. But the next thing is that we need to have our psychiatrists feel enabled and supported in working with communities, working with young people, working with other professionals in training roles as well as direct care roles. And not only in training, but in taking the journey so that they're accessible to primary health workers, maternal and child health workers when they need further support. That the inequities in service provision in Africa compared with Australia or UK are changed. So that we also, I suppose this is a part of a second wish, that we have a brain circulation instead of a brain drain around the world of professionals. We lose them, that people are trained with the precious resources in Rwanda or in other countries, and they end up, we always have need for psychiatrists in any countries, but they end up in the much wealthier countries. And I think the continuing education to support professionals to work in adversity, to work in informal settlements and slums as well as after disasters, and to adopt the principles that have been set out by WHO and the major non-government organisations that deal with how to work with others, how to provide care in appropriate ways, and go beyond the clinical care and embrace human rights and support for working with others.
Thanks very much indeed. Vikram, why don't you give a few closing remarks and looking forward?
So looking forward, I would say that what we've heard really is the need for us to work in a partnership model. I think today we published the commission, and I would encourage each and every one of you to look at the commission. I know not all of you will have the patience to go through 25,000 words, although it's in such a good journal. But I do think that all of you will find its messages digestible in one form or the other. Please log on to www.lancet.org globalmentalhealthcommission.org. As you do so, and I hope the website can be shown in screenshots now, I'd like to first of all acknowledge the enormous effort that many people outside the Commission have done in order to take these messages out. On this website, you will find a number of different resources, including overview videos, animated videos. You'll see already 2 wonderful animations by young people, slam poets, and there'll be more coming up, who have looked at the Commission and tried to create poetry around their own lived experience. There's a lot more on that site, but most importantly, there's a space for each and every one of you to get engaged, to read, to give comments, to get involved. And I would encourage you to also be critical, because there is no way that a single report by 28 people can reflect every single point of view. That is not the goal of the Commission. The goal of the Commission is to continue to advance debate, to continue to advance a discussion, constantly striving for agreement and consensus, while recognizing there will always be differences in point of view. In closing, I think the key element of this Commission that I want to leave you with is the idea that mental health is something we all aspire to. It is not about the other. It is about each and every one of us. Promoting our mental health, ensuring we stay well, but at the same time ensuring that when our mental health is at risk, that we are protected, and when we are affected by mental health problems, that we have the right to choice and the right to care. These are the foundational principles of the Lancet Commission. Our reframing of mental health, we think, is exactly aligned with the core SDG principle of leaving no one behind, and indeed is also completely consistent with contemporary notions of human capabilities and the emerging notion of human capital that is being promoted by the World Bank. If we are to achieve these ambitious and audacious goals, not just of reducing the treatment gap, but moving well beyond that, to actually reducing the global burden of mental health suffering, then I think we're going to have to work in a partnership model. A partnership that brings together very many different constituencies. Obviously, we've heard from mental health professionals, people with a lived experience. We've got policymakers in the room and the development community. We have to work together. And I think in working together, we have to start with the areas we agree on. Because while there might be areas we disagree on, what's more important are the areas we agree on. And I hope very much that the Commission has laid out the fact that what we do agree on is that mental health is a global public good. It isn't just a health concern. It isn't just a clinical concern. It is a global public good that is important to every person in every society, in every country. Thank you very much.
Well done. Well done. Thank you very much, Vikram. Thank you to the panel. Please do stay here. I want to give our pledge, our commitment, that we're not going to move on from this commission. We're going to make sure that we are fully committed to seeing these recommendations implemented, and we want to build an unprecedented coalition amongst all of you to strengthen accountability, to monitor, review, and act on the recommendations this Commission has. It's now my great pleasure to introduce the Minister of Health for Canada, Minister Jeanette Petitpas-Taylor, who I think is going to give some closing remarks.
Fine.
Hold on. Can I, my friend, I absolutely want you to have an opportunity to say something, but could I ask you to wait until after refreshments? So I would like to give the Minister an opportunity to respond to everything you've heard this morning. Please, Minister.
Great, thank you so much. As Canada's Health Minister, I have to say I'm extremely grateful to be here today in order to take part in this global conversation about mental health. I would also like to thank the panelists for their compelling discussion. You have certainly given us a lot to think about as we strive to promote positive mental health around the world. And thank you for your candid comments today. I certainly appreciated them. This is truly an exciting time for all of us, and I know I'm excited about the work ahead. The focus on mental health is gaining momentum globally, and I have to say, it's truly about time. A few weeks ago, I was in New York for the United Nations General Assembly, and I was grateful to participate in the first ever UN meeting on mental health. But again, I was surprised that it was the first such meeting. In my remarks there, I mentioned how I find it curious that mental illness is not typically considered an issue of global health. And in my mind, it is the most global of them all, and I would think that you would agree. By working together, we can make progress that was once unimaginable. Last May, at the World Health Assembly in Geneva, I was proud to join my colleagues from Australia and United Kingdom in founding the Alliance of Champions for Mental Health and Well-Being. The Alliance will meet for the first time later on this afternoon. This is a chance for political leadership. Together, we can set international objectives surrounding mental health, raise awareness, and share best practices. The recommendations of the Lancet Commission show the way forward. They provide a blueprint for developing policy on mental health and sustainable development. Most of all, they show how to turn discussions into action. That action starts with promoting positive mental health, fostering an open and honest and productive dialogue. This means looking beyond clinical settings to recognize the systemic issues that affect mental health. As the Lancet Commission rightly points out, if we want to address discrimination, social and gender inequalities, reduce poverty, and increase prosperity, we cannot ignore mental health. This requires us to work, and it requires us to ask some hard questions of ourselves, both celebrating our successes, but also acknowledging our shortcomings. It means considering all of the social determinants of health. And when I say, I mean mental health as well. On a political level, this means a whole of society approach, not just me as Canada's health minister, but the finance minister too, the labor minister, the transportation minister, the housing minister, and the list goes on. Culture change is raising a new generation with new ideas about mental health and wellness. Fortunately, youth are leading the incredible efforts to promote positive mental health worldwide, and I'm lucky to have one with me here today. Nicholas Vanderburgh, and Nicholas, where are you in the room? There, thank you. Nicholas is a trailblazer working to foster discussion about mental health among his peers. Nicholas is an alumnus of an organization called jack.org, which empowers young people to change how we approach mental health. Their efforts are totally youth-led, speaking to their peers, by their peers, establishing local chapters, and holding summits. Promoting and protecting the mental health and wellness of our youth is critically important, but we can't do it without talking to them, empowering them, and learning from them and from their experiences. Making sure that we include those with lived experience is essential to changing the conversation around mental health. And it also means changing how that we talk about it. Stigma continues to be a barrier to both treatment and access to other health and social services, especially for people who use drugs and those affected by suicide. The words we use to refer to mental health can perpetuate stigma. Without knowing it, we are reinforcing division and isolating those who need help the most, with untold numbers of people suffering alone. However, as mental health awareness is growing, perceptions are starting to change. This is thanks, in part, to courageous people like Nicholas, Grace, and many others that are here today that have shared their stories. But it is also happening because our leaders are putting mental health on the agenda and publicly committing to addressing it. Our Prime Minister Justin Trudeau, for example, has made mental health a priority in our country. Earlier, I mentioned how mental health shouldn't be the responsibility of the health minister alone. Well, in Canada, several ministers share this responsibility. For example, I'm working with my colleagues from the Minister of Public Safety and Veterans Affairs to raise awareness and develop better support for those who suffer or live with post-traumatic stress injuries. Ultimately, our goal is to build the kind of society where everyone, and I stress everyone, can thrive. Diverse, inclusive communities that supports everyone's mental health. But there certainly remains much more to be done. We must continue to protect human rights of people with mental illness, and we must never forget that mental wellness is not just a clinical or health system concern, but also central to achieving the Sustainable Development Goals, as we heard this morning. We need to act now if we want to achieve Agenda 2030 and ensure that physical, mental, and social well-being of people worldwide. Our collective voice can spur action on today's most pressing challenges, including mental health. And that's why that I invite all ministers here today to join the Alliance of Champions for Mental Health and Well-being. I am proud to be a part of this global movement. Inspired by the Commission, together we can promote social inclusion and human rights for all. We can and we must end stigma. And we can achieve our shared goals of leaving no one behind. So I challenge you all to get moving. Thank you so much once again for the opportunity.
Okay. Got it right this time. Thank you very much. Thank you very much to the Lancet Commission. You can all go off for coffee. Come back in about 20 minutes where we will have ministerial reflections on the recommendations and some closing remarks before you can all go and eat. Thank you very much.
Could I just request
please. So ministers from Norway, Nepal, Sri Lanka, Iceland, Ghana, and Nigeria. Now, there should be enough room for me to sit down up this end. So, do you want to sit in the middle, perhaps? Or, no, have we got enough seats? No, you sit there.
Yes, sir.
Perfect. Perfect. Okay, so have we got more people coming in? Does everyone want to grab a seat? Okay. Okay, so we've launched the Lancet Commission on Global Mental Health. We've had royal visits from a Duke and Duchess. We've had people like Alistair Campbell and Richard Curtis, fame of Love Actually and 4 Weddings and a Funeral. Matt Haig, Arthur Evans. We've had WHO and OECD and the Department of Health, and soon we will be coming to a close. But before then, we're asking specific ministers to make a response to the recommendations that you have drawn up. Now, the global declaration is going up onto the app, so you will be able to see the declaration that the ministers have agreed to up on the app. And that's an agreement about supporting mental health equality in the 21st century. And that's not to reach equality by the end of the 21st century. That would be a ridiculous timescale. It's now in the 21st century, as soon as we can do it. So the declaration will be up there. There will also be, so the declaration will look a bit like this. There will also be the recommendations. And as I said, I'm taking the declaration and the recommendations tomorrow down to the WHO MHGAP conference. Okay, so there are also some copies of these if people want to pick them up on their way out. But I think we've only managed to print up 60 or so that's entirely up to you. Okay, so what I'm going to do is to ask the ministers to respond in turn. We've got about 35 minutes in total, so if we could keep it reasonably brief. And we'll start off with the Just Society, which Nigeria, Minister Emmanuel Ehanir, I think is the name. Yep. And if you'd like to respond first.
Thank you. I think it's projected.
It was going to be projected.
Okay. Now, the recommendations here are 4, and they are quite good recommendations. But the difference I will see is that the starting point, and I did hear the Honorable Minister of Health speak about the starting point for countries that are already developed, and then the low and lower medium income countries. We do not all have the same starting point with regards to these statistics. So to require all nations to publish baseline data for sustainable development goal mental health related indicators, number 1, suicide reduction, alcohol use disorder coverage and treatment, and the drug use disorder coverage and treatment, by 2030 may not be feasible, because there is, although the idea itself is very good, but I do believe that many of the countries have not developed their data that far. Nigeria has already done the National Epidemiological Network for Drug Use, which included studies on alcohol. We call it the NENDU. That's already there. We have that, but we can't claim same for all other countries. We have had particular experience with covering drug use disorder, substance use disorder in Nigeria, particularly among the youth. It has been in the news recently. And we have also had quite some experience with covering mental health issues in the Northeast, which some people, many of you here will know of the insurgency, Boko Haram insurgency in Northeast. The Ministry of Health has carried out certain interventions that address the peculiar mental health issues arising from there. Now, the second recommendation, which is full, diverse, and effective participation of experts by experience in leadership of developing, implementing, monitoring the law, policy, and practice at all levels, including relevant sectors, through a human-centered perspective, is a good recommendation, and I believe can be followed by everybody, and is very well accepted. Now, the third is to adopt policies and programs which ensure that mental health is part of a public health approach with equitable funding at all levels. That we also think is a very, very good and desirable objective. But we must also say that many developing countries do not have very efficient primary healthcare systems. We have hospitals in major cities, but the participation in universal health coverage is low in some areas. In Nigeria, we are just focusing now on primary healthcare. The focus has been before now on the large hospitals in large cities, in urban areas. We're beginning to take healthcare to the people, and at the time this government came in, only 20% of primary healthcare centers were functional. After 3 years, 50% are functional. We intend to drive it up to 80, 90% within the next 3 years. And that will be a platform by which both physical and mental health service will be delivered. And we believe that we also need the human resource for health for these kind of services. And we need to go to do a lot of training of this personnel in multitasking and in task shifting to go to cover all the program areas that are needed for delivering primary health care across the board, and that mental health care will be an integral part of primary health care delivery. The fourth is creating a learning experience for all legislators, government policymakers, and legislators on basic mental health care delivered by people with lived experience of mental health problems. That is very helpful, very useful, and in my country, we have a bicameral parliament, the Senate and the House of Representatives. The Senate is led by a medical doctor, and the House Committee, Senate Committee on Health is also a medical doctor, so they have been very supportive. We have the advantage of being able to get their attention. But that is not so everywhere, and with regard to allocation of resources, we have also been able to get a basic healthcare provision fund, which is 1% of consolidated revenue in addition to the normal health budget, which started this year and will be sustained every year. The engagement of the legislators would begin, I believe, with the House committees and the Senate committees, and once we get them on board, other members of the legislature will definitely come in. And I do believe that these recommendations should be accepted and adopted with the conditions that I have given.
Okay. Thank you very much. I mean, it sounds as if that most of this is something that we think we could achieve, but the specifics around halving suicide rates and doubling treatment for drug misuse and alcohol may prove problematic in the time scale. I think that's right. Yeah. Okay. So time scales. Okay, so let's move on to a caring society from the Deputy Prime Minister of Nepal, Upendra Yadav. Do you want to come up? Or?
Yeah.
Okay.
Mr. Chair, Honorable Ministers, distinguished guests and delegates, ladies and gentlemen. It is indeed my distinct honor and great pleasure to attend the significant Global Ministerial Mental Health Summit in London. I would, at the outset, like to express my gratitude to the Government of United Kingdom, WHO and OECD for inviting me to this important international convention focused on the mental health. On the auspicious occasion of International Mental Health Day, which is being observed today, the 10th of October, I would like to pay tribute to all mental health professionals for their enormous contribution. Mental health problems are emerging as a big challenge, not only to the developing and the least developed countries, but also to the world communities. My own country, Nepal, is also suffering from this severe problem. At present, 4 out of 5 people with severe mental illness are found from low and middle income countries who are unfortunately receiving no effective treatment. The South Asian region, which has occupied 1/4 population of the world, has 1/5 mentally ill patients. Poverty in Nepal, compounded by illiteracy, unemployment, migration, social integration, and natural disasters, which has contributed to the mental health problems in the country and is increasing day by day. Approximately 7 million Nepali people are suffering from mental illness, depression, anxiety, post-traumatic stress disorder, psychosis, substance abuse disorder, increasing level of aggressive behavior and violence among the youth, and dementia are daunting challenges for us. The problem of mental health has become a major concern, and the government of Nepal is facing a daunting challenge to tackle it due to the limited financial and human resources in the country. There is lack of cross-governmental engagement and funding for mental health, and lack of co-produced leadership in mental health with civic society and those with lived experience. However, the government of Nepal has taken some major steps to minimize its problem by providing minimum health service and public engagement in this sector. We have initiated it through the policy of formation and implementation. The Constitution of Nepal has clearly mentioned that the basic health is the fundamental rights of every citizen. It has thus signified that mental health service is also fundamental rights of every Nepali citizen. The government of Nepal is committed to implement the policy of every access to every Nepali citizen to health services in affordable cost. The government has also announced free basic health services from local level, a specialized and referral health service from provinces, and modern and specialist health service from the central health institutions. We have been implementing the National Mental Health Policy, which aims at ensuring availability and accessibility of minimum mental health service for all the people of Nepal, particularly the most vulnerable and underprivileged groups of population, by integration of mental health into general health services system of the country. It also aims at improving awareness about mental health, mental disorder, and promotion of mentally healthy lifestyle, and at producing human resources in the area of mental health in order to provide necessary mental health service to the people. I am delighted to mention the suggestions carrying society's work stream and appreciate the contribution of co-chair Mr. Poppy German and Mr. Paul Farmer. The prevention of mental health problems in society and the prevention of suicide must be reflected in current government strategies, which must be multi-sectoral and create a network of advocates to promote mental health. All governments should ensure that as equal citizens, people have the right to good mental health, fulfilling work and family life, participation in civic life, and voice in shaping mental health policy. Cities and workplaces are driving transformational approaches to mental health. Government should support city-wide initiatives for better mental health, connecting with the growing network of global cities leading the way. As the large employers and legislators, government should ensure they strategically support their employees and use legislation to set clear expectations on employers. I am pleased to note that the international community has always been appreciative and supportive of the efforts of the government of Nepal. We hope and believe that Nepal receives generous support and cooperation from the friendly government and the international community to tackle the problem of health in general and particularly the problem of mental health, and achieve the national goal of making prosperous Nepal and happy Nepali. I am fully confident that the summit will be able to arrive at a significant, substantial, successful conclusions. I am also hopeful that the decision, recommendations, and declaration of the summit will be beneficial for the developing and least developed countries, including my own country, Nepal. Thank you all for your kind attention.
Okay, we're going to have to keep things a little shorter because we're going to run out of time. So moving on to children, Bent Hoey, is it? From Norway, would you like to give your reflections on the children and young people work stream?
I will. Thank
Fantastic.
you. Fantastic. Thank you very much. And I not only want to give my reflection on their recommendation, but I also will say from day I will also be the ambassador for their recommendation because they are very important.
Fantastic.
The recommendation number one is, of course, the right of universal health care for all. And that is especially important for young people and children, because we know that the majority of people that get mental health problems during their life get them the first time when they are children and young. So we have to ensure universal health coverage for children and young people, and we, of course, as has been said many times today, there is no health without mental health. Their recommendation number two is very important. They say no decision about us without us. And that is also my vision for all I do in creating the healthcare system in Norway. And we know that it's important with a change of mind in our healthcare system. Today, too many seek help are met not with warmth, understanding, and generosity, but with coercion and unnecessary force. If we are to achieve equality between mental and physical health in the 21st century, we must leave the 20th century practice behind us. And then the recommendation number three is that all nations must support and fund physical and mental health integration. And that is so true. Norway is a country with equality of a high standard. But the biggest inequality in our country is that people that have a combination of mental health problem and addiction have a life experience in Norway that is 20 years shorter than the people at all. And that is the biggest inequality and also the cruel inequality in our country. So and what makes me as a health minister ashamed is that the main reason for this difference is that people with mental health problems and with addictionary, they don't get care for their physical health problem. They don't get cancer care, they don't get care for their health and lung problems, and that's the main reason for this inequality. So we need to listen to this recommendation with the physical and mental health integration. And the third recommendation is that ministers across government must promote mental health environments at all areas. And that is especially important for children and young people. And then we especially have to have our attention on our school system and education. Young people must learn in school how they can take care of their mental health as the same way as they learn to take care of their physical health. So from today, I'm the ambassador for these 4 recommendations. Thank you very much.
Thank you very much. And we'll move on to mental health services around the world and Sri Lanka Minister Dr. Rajita Sanaratne. Do you want to give us a few minutes of response to mental health services around the world?
Yeah, actually, first of all, we must thank actually for organizing the first ever World Summit on Mental Health. Because all these years, actually, globally the main problem is the non-communicable diseases and plus mental health. So for non-communicable diseases, actually a good place is given under the WHO and all other international fora. And there is a good campaign, but not for mental health. So in that instance, it's a great thing that you all actually summoned this World Summit and also giving all the countries to have a actually idea of improving our mental health in our countries. Now when you take about even the society, the recommendations on the society, first thing is the suicide. That is the main thing that we have to tackle. Actually save their lives. That's the main thing. So we have to decide on what actions that the government should do to prevent suicide. At least first you have to save the life, then only then you can take the other actions to treat the mental illnesses. Second thing is actually to the mental health patient to be actually to give him the same status of any other citizen, the equal status for them, without actually in our villages also, according to the traditional beliefs, actually they have been actually isolated, they have been ill-treated, they have been separated, they have been differently, they have been served. All that has to be stopped, and there must be some legislations also to be enacted in the government. The third thing is about actually the financial allocations that the recommendation says actually the lower income countries to increase by 5% and the high income countries to increase the budget by 10%. But in my case, I will tell that the Sri Lanka will definitely increase by 10% because we have already for the last, we have been a British colony earlier for the last 7 decades after the independence. We have practiced free education, free health, right? Totally free. Even all the cancer treatments are free, all the cardiac stents are given free, cataract lenses are given free, all the orthopedic appliances, everything totally free. We have given the most important after the national security, the most important in the budgetary allowances is the health and education. So we are ready to do anything for any increase for health. So therefore we will recommend to the government for the, I think now our budget is already prepared for the next year, at least for 2020, to increase the budget by 10%. And
so specifically to increase the budget for mental health by 10%?
Mental health, yes.
By
2020, because already our budget is being prepared because the budget debate is starting on the 5th of November.
Excellent.
So,
and then all we need after that is for it to keep going up.
Yes. So therefore, these recommendations are okay. We comment about this.
Fantastic.
Thank you.
Thank you very much. We're going to move swiftly on to the research recommendations and ask the Minister from Iceland, Svandís Svavarsdóttir.
I prefer standing, if it's okay.
Yeah.
When I speak and when I give
No,
birth,
that's fine.
I prefer standing. Thank you. Chairman, ministers, and distinguished ladies and gentlemen, I am delighted and honored to be and have been able to participate in this groundbreaking summit here. There have been many important developments in mental health in the past few decades. The focus on human rights and empowerment in mental health is an important step forward. So is the emphasis on providing integrated care where people live. Recognizing that prevention is an integral facet of improving mental health has also moved us forward. Perhaps one of the most significant breakthroughs in improving mental health on a national and global level is the realization of that mental health is a joint venture. That requires the dedicated collaboration and financing of many systems, such as healthcare, educational institutions, social services, judicial system, and of the people themselves. I would like to tell you about the commitments of the new government of Iceland in very few words that took office in the end of last year. The government is committed to further strengthen mental health care and promotion in Iceland and has significantly increased financial contributions to these sectors. A sign of dedication to this cause was the first ministerial report on the status of mental health in Iceland that was presented our parliament, Alþingi, last spring. We practice the whole of government and the whole of society approach in promoting and protecting health because the agenda emphasizes engagement and cooperation of governance in all policy areas and all sectors. We have recent important policies with corresponding action plans focusing on improving mental health in Iceland. The mental health policy and the public health policy. We have also started work on our new national health policy. In addition, we have a special and very new action plan for suicide prevention. We are actually aware of the importance of prevention, early interventions, and integrated care. Iceland has health-promoting preschools, primary schools, and secondary schools, as well as we have health-promoting municipalities. We are actively promoting primary health care as the first point of entry into our healthcare system. We are increasing the number of psychologists in primary care, and mental health teams are being established across the country. We are clarifying the roles of the primary, secondary, and tertiary care and defining routes of successful collaboration. The Ministry of Health is actively collaborating with other ministries, the municipalities, non-governmental organizations, stakeholders, and experts by experience towards building better mental health. Our goal is that our nation will be
Suddenly you've gone off.
Iceland recognizes the importance of science and evidence-based policies and innovations. We respect that all people have the right to make their own informed decisions about their health, and that they have the right to treatments that have been scientifically proven successful. Ladies and gentlemen, Research is the engine that will propel us forward to the best practices in mental health care and promotion. We need to strengthen the ties between research and practice. These are exciting times. We are taking important steps toward a healthier future for us all. We stand united in our common goal, better mental health for all. Thank you for your attention.
Thank you very much. And for our final minister is Deputy Prime Minister from Ghana, Tina. I'm sorry, this is all written in hand. Sorry, Mercer. Yeah, Tina Mercer. It's all handwritten. It's not mine. Okay. So do you want to stand up or do you want to sit?
No, I just want to sit down.
You carry on.
Thanks, yeah. Thank you very much for the opportunity. Distinguished dignitaries present here, I bring you greetings from Ghana, from the government and the people of Ghana. Thanks also for the opportunity for us to contribute to this forum. Ghana seeing the importance of mental health. It has integrated mental health into to be part of the total health. Until recently, our treatment gap was 98% as estimated by the World Health in 2005. And our own study also shows 41% of Ghanaians as having sociological distress. So Ghana, we took it upon ourselves to do something serious about it. And we are making frantic efforts to improve our situation. Hence, we have enacted an act. We have enacted an act on 2012 at 846, which gives us the situation, the better of the situations of the mental health people. Then we have created a special agency for the Mental Health Authority to take care of themselves. So out of the Ministry of Health, the mental health has been separated so that it can cater for its own needs, and then we can do things quickly in order to charge them. We have also referencing our budgetary allocation for mental health care, even though it's not adequate. Over the years, I think about 1% or less than 1% was allocated to national health, the mental health. But I think as time goes on, we are increasing it, and gradually we'll also increase it. We are collaborating with our development partners, particularly the DFID, which has given £3 million towards mental health within the last 5 years. And they are promising to do more. These investments have yielded evidence. Our human resources have remarkably improved. A number of psychiatric clinical nurses and all those things have also doubled up within the last 10 years. Treatment gap has reduced from 98% to 75%. We are also serious with our human rights abuses when it comes to mental health conditions. And we stand committed strongly to that, to make sure people are not chained anymore, people that are sent to prayer camps, people that are sent to mental homes are not maltreated. So the government is so serious and committed to making sure. So advocacy and all these things is going on to it. We are also giving listening ears to people with mental conditions so that they can voice out to the situation. As few more things needs to be done though, and Ghana is poised to do just that. We need to pass an enabling subsidiary legislation to support the Parent Mental Health Act, which it is there, and we need to support it. We need to establish a levy for lifeblood of mental health care. Some more governance structures created in law need to be established. For instance, mental health review tribunal and visiting committees, etc. Ghana has realized that it pays to invest economically in mental health care And this we are on course towards doing. We believe that mental health care in Ghana will never be the same if we invest more into it. So this is what the government intends, to invest more into mental health care in Ghana.
Thank you very much. Now, I wish we had time for more. At the ministerial breakfast, there was lots of other ministers who had lots of things to say, and we went well over time. I was very impressed with the very positive response from ministers. And as you can hear, people are wanting to do something, people are starting to do something, and everyone's committed to a 50% increase in their budgets for mental health. Oh, no, you didn't say that. Thank you very much for coming out and sharing your thoughts. Could we give a round of applause for the minister? Okay, thank you. Okay, so as our ministers depart, we've got three more very relatively brief speakers, I think. So I think, are we starting off with Birgitta or Bill? Birgitta, why don't you come first? Okay, we'll have Birgitta.
Excellencies, ladies and gentlemen, let me first say how honoured I am to be part of this unique conference and thank the government of the UK for their leadership in organising this excellent getting together on this important theme. Everything I've heard today has made a very strong impression on me. There were very moving stories, and they also hit me personally, being a mother of 4, of whom 3 stepchildren that came with traumas in the household. And hearing your stories, I now realize that, we could have used some skills on how to deal with that in order to prevent traumas turn into mental health problems. And we could have used some skills in dealing with those once they surfaced. So I thank you very much for that insight, and I know that I will be a better mother after today. It's very clear that the summit made very clear that we urgently need to start prioritizing mental health and psychosocial support, not only for our own citizens, but for all those millions of people living in areas ravaged by armed conflict and natural disasters. And when I meet parents and children affected by crisis, it strikes me how much resilience they show and how eager they are to rebuild their lives despite all that they have lived through. And I've seen it in Gaza, Mosul, Erbil, Lebanon, Niger, but the list is obviously much and much longer. And listening to their stories, I also realize how fragile their situation is. There's no question that good mental health services need to be offered during humanitarian crisis. And yet, mental health and psychosocial support is normally not integrated into humanitarian response. In emergency settings, there is a treatment gap of more than 90%. And despite all our knowledge, despite desperate needs, and despite the efforts and good work of many of you here today, and much more is needed than individual services alone, prevention of psychological problems is equally important. And we, the international community, can and must do this together. Yesterday, Alistair Campbell asked which country was a champion in mental health, and he actually volunteered Holland. He mentioned, obviously, the Netherlands. Holland is a couple of centuries ago. And the reason was that it was actually still when Holland was fighting England. Anyway, the reason was that the Netherlands was sending heroin addicts to hospitals in Scotland. Well, whatever the reason, I will pocket the nomination, and therefore I'm all the more happy to announce on behalf of the Minister for Development Cooperation and Foreign Trade, Minister Kaag, and with the support of the Ministry of Health, Welfare and Sport, that the Netherlands Ministry of Foreign Affairs will host the 2nd International Mental Health Summit in Amsterdam in October 2019. The summit will focus specifically on mental health and psychosocial support in emergency settings. And I hope your countries will join us and that we can all continue to work together to step up our efforts and encourage new ways of thinking. And I know I'm preaching to the converted when I say that we must do whatever is needed to put our knowledge into action, tackle discrimination and stigmatization, and make a difference to people's lives, leaving no one nowhere behind. Thank you very much.
Thank you, Vicky. And great news that we're going to the Netherlands next year. Thank you. The next person I want you to hear from is Simon Stevens, who is the Chief Executive of NHS England. He has about £100 billion a year to spend on health, and he has openly committed to increasing the spend on mental health year on year until we get somewhere better. Now, over the last 2 or 3 years, the spending on mental health has seriously gone up for children and for adults in England, and that is down to, I'm sure, a lot of different people across government, but Simon Stevens has been absolutely instrumental. So could you put your hands together for Simon Stevens?
Well, thanks very much, Tim. And I will definitely be brief because I have actually, unfortunately, got to go from here straight to have a surgical procedure on my shoulder, which the scheduling flexibility of the National Health Service was such that I was just literally able to kind of swing by this brilliant discussion. And I look forward to seeing you all again in the Netherlands in a year's time. But the fact is that for most of us working in the health service, we've had either family experiences or formative professional experiences in mental health services, and that's partly what puts fire in our belly. For me, I started work in the NHS 30 years ago, and within my first few days, as I was as a young sort of graduate trainee, being given the opportunity to look around parts of the health service in Newcastle, I happened to be at the old Victorian Psychiatric Hospital just outside Newcastle, and was asked by the fellow who was running it, what are you doing tonight? Which I thought was a rather strange sort of opening gambit. But anyway, it turned out this was not kind of a social invitation. This guy named Lionel Joyce said, well, look, why don't we just admit you kind of anonymously to one of the long-stay psychiatric wards at this hospital, and you can see for yourself just how appalling it is. Now, that's not what you often hear said from people running services and institutions, but I have to say it made a very strong impact on me. And over the years, we've seen huge gains in many countries. But the fact is, as this whole summit has been all about, this is an unfinished revolution. And frankly, we are at the moment in many countries when I think people realise we've got to significantly raise our game. So I just, in the very brief period of time before I go under the knife, want to sort of put 4 or 5 questions out there, which I think are some of the dilemmas that we grapple with as we try and make good on that promise. The first, of course, is that, by definition, we are needing a more concerted focus on mental health services alongside the concerted focus that healthcare has always had around physical health services. And that often leads us to want to have ring-fenced funding. That's what we've been doing in England in recent years. Beef up the workforce in mental health services, often separate organisations delivering mental health services. And yet one of the great dilemmas, frankly, is that the move towards holistic support means that the physical and mental health demarcations have increasingly got to blur. So in the case of the life expectancy inequality that exists in England for people with severe and enduring mental health problems, it turns out that one of the key sets of drivers of those are, of course, neglected physical health concerns. And if we have separately partitioned mental health services and physical health services, and ne'er the twain shall meet, we continue to perpetuate that. You are twice as likely to die young from cancer if you have recently been in touch with our specialist mental health services, 3.3 times likely to die younger from cardiovascular disease, 4.6 7 times from respiratory and 5 times more from liver disease. So we've actually got to build in proper physical health support at all these touch points with our specialist mental health services. And the flip side is that for people using physical health services, our multi-morbidity services for congestive heart failure and diabetes and COPD and a whole range of other conditions, increasingly mental health services in England are trying to think, how do we make sure that the psychological aspects of those are built in? So we can't just have separate funding streams and separate organisational delivery partitioned, because that's not, as humans, what we need. So the dilemma is, how do we get the best of both? A second dilemma is a dilemma around focusing on the common, highly prevalent psychological disorders that in England the IAPT programme has been focused on, while not doing so at the expense of the severe needs of people with long-term mental health problems, where core services, crisis support, other models of care often do not get the resourcing and the workforce they need. And that's a balance that we've got to kind of restrike, I would say, as we look at the long-term plan in the National Health Service over the next 5 years. We've got an economic case to make to finance ministries and treasuries. And we all know the human cost of unmet mental health need. There is also clearly a very strong economic argument, both in terms of the ability for people to lead, to work, and to therefore be less likely to be having to rely on public assistance or welfare benefits. We're running now controlled trials in different parts of England, looking at whether proper mental health support early on will actually help people back into work, as well as be good for themselves and their families. And I think as those data accumulate, rather than the kind of broader economic arguments that we make, we've got to be very assertive about showing that this will be a smart investment for society as a whole, not just because it's the right thing to do for people and for health services. So how do we crystallise those arguments in a way that are persuasive to people who are not naturally to be found in rooms such as this? We've got to catalyse, we've got to use the moment as stigma comes down to ensure that mental health professional work, signing up for psychiatry, for mental health nursing, where we've got particular pressures in this country, psychological support, peer support, we actually cash this change in the public mood and debate into the attractiveness of coming to work in what is going to be an expanding sector, because there's no point having extra funding if actually we can't staff the services that are needed. And we've got particular pressures in England about the rate at which we can expand services based on the availability of human resources. And then lastly, we've got a series of unresolved debates around prevention and going upstream. In this country, the Prime Minister today has obviously been talking about the role that support in schools could play to reducing the downstream need for specialist children and adolescent mental health services. To some extent, this is a hypothesis. We don't know in this country exactly what the kind of ratio of upstream support does for the need for downstream care. We know we've got very significant service gaps in young people's mental health services, and as you've discussed, we were only looking after about 1/3 of the people on the current prevalence survey of young people who potentially would benefit from specialist support. We've got to cash that out, but as we do so, we've got to, in just the same way as we do with other aspects of our public health debate, think about the broader influences on young people's mental health and well-being. So, take social media. I think we've now got enough evidence and research into the impact of social media on mental health. Although it's not fully developed, there's widespread acceptance that overuse of these platforms can have a detrimental effect on our children and young people. Mental health services, particularly for young people, are reporting an increased number of admissions linked to use of social media, and some companies themselves are starting to recognise this with the potential safety risks from their activities. WhatsApp, owned by Facebook, recently raised the minimum age requirement from 13 to 16, and Facebook has publicly acknowledged the challenges that it faces. So we now need to consider, collectively, what else social media platforms, which have expanded faster than regulation's ability to respond, need to do to help stem the tide of mental ill health in this country and others, or at least help pick up the pieces. In other countries, in other industries, where there are adverse consequences from commercial activities, each service contributes a proportion of its turnover to an organisation or a cause intended to mitigate adverse side effects or to offset harm. For example, in this country, the banking levy in 2008, subsequent to the 2008 crash, funding the money advice service to help people in debt paid by lenders. Energy companies fund a consumer helpline and research into better markets, and gambling firms are increasingly being asked to contribute to Gamble Aware. So as evidence in this country emerges, and the Chief Medical Officer is currently looking at what we know and the impact of social media, we need to consider the links between health and technology for better, in many cases, but also for worse, and under these circumstances discuss whether the equivalent of a mental health levy would be proportionate response, both in terms of changing behaviour on the part of the companies involved and in terms of providing a funding stream for the expanded services we all want to see. So those are just a few of the debates that, frankly, are still pending, but will no doubt be resolved by the time the Amsterdam gathering occurs. Thank you very much to Tim, to you all for making this event such a success as it has been, and it's a conversation that we're all going to continue together. Thank you.
Thank you, Simon. I wonder how the surgeon's feeling. A little anxious, Okay, now, you know, the NHS in England may be fairly widely known and sometimes emulated around the world, but probably better known is the English Premier League. And the Premier League have helped fund this summit in part. But also, I need to say, before I ask Bill Bush, the Executive Director of the Premier League, to come up and say a few words, I should say we're starting to collaborate with the Premier League. We're collaborating with the equivalent for rugby and the Professional Footballers Association and others. Around about 70% of all the people who kill themselves in England are men who don't talk much. They don't connect with services, they're not talking to people in mental health, but they are going to football clubs, they are going to rugby clubs. So I'm very pleased to ask for the last few words to come from Bill Bush, Executive Director of the Premier League.
So close to lunch. I apologise for taking up your time. But it was very important reasons why the Premier League said an emphatic and enthusiastic yes when we were asked to contribute some funding to help this event work. Yes, we're known around the world for really very good football competition. For those who don't like it, I strongly recommend it. We are the most watched football competition, sporting competition in the world. But our clubs have immense deep roots in their communities, and other clubs beyond the Premier League, which we also fund and support, have enormous community connection. We now fund and support over 2,000 people working in communities in some of the toughest urban environments in England and Wales. And over the last 10 years, we've gone from jumpers from goalposts, bags of balls, get the kids to kick a ball around, to dealing with what is a wide range of health, particularly mental health challenges. We train our coaches, our community coaches, to deal with aspects of mental health, not as experts, but as signposters to the true experts, people that you know far better than we do. One thing football can do is break down the stigma, the barriers. Young men, it's not just young men, but young working class men won't talk about much, they'll talk about football. They may not respect many authority figures in their lives. They'll respect the club coach with the badge on his chest or her chest who's prepared to talk to them and listen to them. In Burnley, we have people working with psychological behavioural experts in schools to deal with the very serious suicide rate there. This is not jumpers for goalposts. This is really serious interventions. We work with young offenders, people leaving prisons with drug abuse problems, alcohol problems, but they'll talk about football and accept us as a gateway to getting real support. So it was, I could go on and on about this. There's so many good projects which I'd love to talk about and even show you that we support and direct. But it is a genuine honour and a pleasure as a Premier League, someone you would not support, an organisation you would not expect support an event like this, to say we had no problem whatsoever in saying, yes, we want to support it, not because we've got the financial resources, although we do, but because every day we have coaches dealing with the challenges which you understand so well, and we want to support you in the work that you do in helping people face lives in a much healthier way. And without respecting the mental health challenge, that cannot be done. So thank you very much for your patience, and enjoy life.
Okay, so we are now coming to an end. There is going to be food afterwards, so please go and stuff yourselves. Sorry, I didn't say that. I keep slipping up. It's been tiring. That's my excuse. I don't think people can hear you. Have we got?
Hello.
If you could make it very quick, because a lot of people have got to go.
I understand that, but I just wanted to say to everyone, really everyone, we're talking about people with poor mental health being honest and talking about their mental health. We need you. We need ministers, government people to be honest with us. We need you to be transparent in everything that we do from here on. And if you can't do something, tell us why. Just tell us why, because that's what we really want to know, is why. And then next year we can move on and find out what we can do. And it's World Mental Health Day, so I just want to say one quick thing, and that's, can everyone just look at the person next to them and smile and give them a hug or a handshake, because we should be embracing this.
Okay.
Thank you, sorry.
Handshakes, hugs, smiles all round. So I didn't misread the note I had at the end yesterday evening that we should go for a team cuddle. Okay. Listen, I do need to thank a few people. I'll make it quick. OECD, WHO, thank you very much for your support and partnership in this. Thank you to the Netherlands, who have stepped up and said that they will take us forward to next year. Thank you also to organisations who've worked tirelessly with us, World Bank, NHS England, Time to Change, McPin, etc. Thank you to Glasgow's. Thank you especially to the expert advisory group, who have really given up a lot of time and thought and given all their connections to us, phone numbers, private stuff that we've been able to use to get hold of people and bring them here. Thank you, everybody, for coming here. We've had a phenomenal response to this, and that's service users, people with lived experience, whether or not they've used services or not. Many have not, and many have not had a chance to. All the professionals and policy people who've come, and all the people who've exhibited around, including Black Thrive, and the Friendship Bench, and so on. And lastly, if I can just name two people, Peter over there, and Sol, who's disappeared, who, I don't know where he is. Is he here, Sol? They have given up the last 18 weeks of their lives. I'm not joking. They have made this happen in 18 weeks, from effectively nothing to putting on something that is seriously worth being proud of. So thank them. I should say they've had a huge team who also deserve a thank you, but they've done a great job. But thank you very much for coming. I should just, one last thing to say before you go, is that I gather there's another meeting that some ministers are going to. There are some cars for you. Peter will be able to tell you. And if there's anything else that you need to know, ask Peter. Thank you very much.
On that final piece of housekeeping, for anybody who is going to the other event at 3 o'clock across the river, my advice would be take a nice stroll, have a bite to eat and take a nice stroll, and please be at the gates of Downing Street at 2:45 in order to be there. Anybody does need some transportation, come and talk to us. We have a limited amount of transportation we can help you with. But please, if you're going to that event, be there at 2:45. And everybody, thank you very much for coming. Thanks.